Good morning, everyone. If I could ask everyone to take their seats. So welcome. I'm Dr. Larry Smith, Chair of the Roundtable on Health Literacy of the National Academies of Science, Engineering, and Medicine. And let me welcome you to, I think, what will be a very exciting roundtable where we discuss the issues of health literacy and clinical trials. As most of you know, clinical trials are the bedrock of deciding what therapeutic interventions work and don't work on patients. And the patients who join clinical trials represent a very special and unique group of patients who, because they take the risks and sometimes the benefits of participating in the trials, we get understanding of what works. But as you probably know, drugs and therapies are often very individualized. And if we don't get broad representation of our patient base, we're never quite sure who will benefit and who won't after the results of early trials. For many of us who have participated in trials, we know that the informed consent often is many pages and filled with lots of legalese because everyone is a little bit anxious when you're using experimental therapies on people. And if you've ever tried to read these consent forms, it is likely that no matter how much education you have had, including physicians, you will have a difficult time knowing what you're actually signing. Many people enroll in trials in periods of extraordinary clinical fright, especially with the diagnosis of cancer, and desperately want access to drugs and don't even look at the informed consent. And the result of that is that they participate in a trial where they don't know what to expect, and often when bad things happen, drop out of the trials, confusing the investigators and weakening the strength of understanding what will work and what won't work. People who have impaired health literacy, people who English is not their primary language, people from lower educational backgrounds, lower socioeconomic backgrounds, these problems are all magnified. And yet it is representation from all of those groups, especially immigrant groups in this country, in the area that I live in, that we need to convince the participants in these trials to understand whether there are in fact differences in responses depending on where you come from. So today I think the opportunity we have is to hear experts from across the country stir our thinking about how are we going to deal with this issue, and how can this roundtable produce a dialogue that may move this whole process forward. I ask each member of the roundtable to be taking notes because at the end of the day we will ask you to speak and give your reflections of the day. But for everyone, there'll be some brief periods of question and answer for the panelists and presenters. So please be ready to do that. The Organizing and Planning Committee, I want to thank the members of that committee, Ann Louise Asaf, Barbara Berra, Terry Davis, Lauren McCormick, Lori Myers, Katina O'Leary, Phyllis Pettit-Nasi, Patty Spears, and Consuelo Wilkins. A lot of work goes into this preparation, and I really want to thank you from both planning the meeting and recruiting such excellent speakers. Our first speaker today, we have two speakers in the first presentation. Barbara Berra is Professor of Medicine at Harvard Medical School and Brigham and Women's Hospital. She co-founded and now leads the Multi-Regional Clinical Trials Center at Brigham and Women's and Harvard. This center is a collaborative effort to improve standards for planning and conduct of international clinical trials. It is specifically focusing on health literacy in clinical trials. Our second speaker, Deborah Kalia, is the founder and president of Patient Advocates in Research, an international communication network of patient advocates who work with research communities, advocacy organizations, and patients. In her current role, Ms. Kalia educates people about research and shares real patient experiences throughout the research process while helping translate discoveries into clinical use. She also founded the Clinical Trials Information Project, which helps cancer patients understand research studies and access to open trials that are relevant to their cancer. So Barbara, can I ask you to come up and start the process, and I'll show you how to use this if you forgot.
No,
All right.